happy to welcome Matt Rieder. So glad you're here. This is a really important topic that you're going to expand our knowledge on, and I'm so happy that I know you and that we were able to set this up today. So thank you and welcome.
Absolutely. Happy to be here.
Yeah. So just to let the listeners know, Matt and I, we live in the same city. So I'm friends with he and his wife, Sandy, and they have an amazing PT. So that's physical therapy and wellness clinic right here. You also work virtually, which is really good to know. So I know as we start to dive into all that we're going to talk into, there may be some further questions that the listeners may have for you personally. So we'll definitely have a way for them to reach out and to learn more specifically about maybe how they can work with you. So today, frozen shoulder. And what is the clinical term for that? I know that this is one that we toss around, but what is it?
Yeah.
It is
It's adhesive capsulitis.
adhesive.
When you
Mhm.
said that, I drew a blank for a second. I was like, do we have one
Oh,
for that? And I was
that's
like, oh, yeah,
right.
we
There was
do.
one. Yeah.
It's adhesive capsulitis, which is, I don't know. I don't even know if it's a really good term for it because it
Mm.
suggests that stuff is sticking together in your shoulder. And
Oh,
I'm still skeptical that that's the whole story behind frozen shoulder, but that's what we call it.
okay. Well, this is a good segue. So
Yeah.
tell us, what exactly is frozen shoulder? So what's happening with that area of our body when we are feeling this pain? Because it is
Right.
painful. Yes,
Yes.
that I
Yeah,
know.
it's crazy painful. So, just to get it out of the way, frozen shoulder has nothing to do with temperature. And I'm not being funny. There's people who are like, oh, frozen shoulder, it must mean it's getting cold. Frozen
Right.
shoulder refers to the fact that at some point in the disease process, your shoulder like doesn't move, like it's frozen in place. So, frozen shoulder is very simply put when your shoulder goes into inflammation override. And inflammation is what happens when our body has kind of anything go wrong with it. Think if you get cut, you'll notice that you see swelling, redness, and pain
Right.
around that cut. If you get an infection anywhere in your body, the same thing happens. So, inflammation is the body's natural response to something's going wrong.
Mm.
And that always comes with swelling, pain. If it's close to the surface, you'll see redness because of the extra blood flow. The swelling is from the extra
Okay.
blood flow. And then the end result of inflammation is always the body wants to put down scar tissue. So,
Ah.
frozen shoulder is when something happens in your shoulder, it starts a cycle of inflammation and it hurts. And what do we do when something hurts? We kind of stop moving it a little bit, we kind of avoid using it.
Mm-hmm.
And also when it hurts, it swells a little bit, and that tends to make the pain get a little bit worse. And then we get in this spiral where, this doesn't happen with every shoulder injury, but with frozen shoulder in particular, we have a spiraling pain inflammation situation where the inflammation makes the pain and what's causing it get worse, and that gets worse, and everything gets worse until next thing you know, you can't sleep on it, you can't move it, it hurts all the time, and eventually the pain gets better, but then the stiffness is left over, and that's that scar tissue. That's where the adhesive capsulitis comes from. Your
Gotcha.
body's not smart about inflammation. Inflammation is a dumb thing. No matter what the problem is, inflammation happens. No matter what the problem is, you're gonna put down scar tissue. And that's
Mm.
great if you cut your skin because you want it to heal over. Not
Right.
so great if it happens in your shoulder and you'd like to be able to reach up or wash your armpit again someday.
Right.
So that's
Right.
what happened. Then after all this inflammation, scar tissue forms, and then you're left with a shoulder that's very stiff.
That's interesting. Okay, so accumulation of scar tissue, is that
Yeah.
where that's causing more inflammation?
So the scar tissue
Or
actually happens after.
okay, so okay, kind of a rebound effect with your
Right.
body
Well, it
responding.
happens afterwards, and that's what holds it tight because frozen shoulder, they describe it as three phases. The inflammatory phase comes first. That's the one that
Okay.
hurts a lot. Then is the frozen phase where it's generally you don't have the constant pain, but if you try to lift it, it's painful. And then they have the unfreezing part. And
Mm.
one weird thing about frozen shoulder is it does sometimes tend to resolve by itself. It just takes forever. Like we're talking years.
Okay.
therapy and treatment can speed up that process.
Okay. And I think I've heard other practitioners talk about it as the thawing process, which is cool because
What did I call it?
no, well, thawing, which,
It's the thawing process. Yeah,
yeah,
that's what it's
it's just a
if I
fun way
said
to.
something wrong, no, that's what it's
Oh
called.
no, oh no, no, no. It's just another term that I've heard them,
Yeah,
because of the three phases. So when you're finally thawing out,
right.
and all this resonates so much because this is something I experienced. So it was actually, it was 2007. No, what year was Hurricane Matthew? 2016, 2017. I think it was
Yeah,
2017. Yeah. I don't have the
some
date in my, on my notes here. But yeah, that was close to what, 8 years ago, and it was pretty sudden for me. It wasn't like I was just, and these are good questions too that I would like for you to kind of talk into is how do we know that maybe something's happening to that area of the body, the shoulder? Is there any way to predict that there's something happening as far as that inflammation? Because I obviously didn't know. I didn't predict it. I didn't do anything to help prevent it or to mitigate it. I think that's always been my thought was there anything should there have been a sign for me to see to maybe get the PT earlier or to work on my whole body inflammation earlier in order to head off what seemed to be just a natural of dropping hormones, the fact that I live with an inflammatory disease, which is a lot of what my listeners hear, which is why they're here. You've mentioned inflammation a few times, and that is a term we are familiar with, living with blood sugar and you know, the glycation of sugar throughout our system. We have been, some of us, many of us, when we go to the doctor, when we get our diagnosis, we're kind of pre-warned that there may be complications, or maybe these are just things that we hear about online, which is where the fear comes from is, whether it's our eyes, it's our limbs, so it's the peripheral areas of our body, or it's the kidney. So those are the three top ones. Again, all that has to do with the vessels. So what's the correlation, or is there, because we know there is it seems like an or an increase of diagnosis, not only with women as our hormones are dropping, but also women living with an inflammatory disease. And I don't know the stats. I don't know if we have the statistics to tell us what the likelihood is. And I was a good example of somebody who's always been active, always been living a pretty good whole foods diet and lifestyle, doing all the right things. And I suffered with this frozen shoulder. Is it an absolute? Is it just something that we can expect at some level that's going to happen to not only women, but women living with diabetes? I know that was a mouthful, but that kind of paints the picture of where we are as our community and our audience. And I want, and my goal is always to inform and to educate so that we can either look for it or identify it if and when it does happen.
Right.
Yeah.
So that's a fantastic question. I want to emphasize that prevention is such an important part of this and everything. One of the challenges we face in our society, medically speaking, is we have a medical system that is very much always trying to play catch up and fix
Mhm.
problems well after they've become severe. And unfortunately, that has gotten into our collective culture. And that's the way we think about healthcare. We think
Yeah.
about healthcare means I've gotten sick or I've gotten hurt and I go to the doctor and they do something about it versus healthcare is me being proactive and getting in front of things that are going to harm me because the bottom line is there are certain things, and frozen shoulder, thank God, isn't one of them, certain things that once you got it, sorry, nothing we can do about it. But
Mm.
okay, I'll try and stay off of that soapbox too much. So
I
to your
appreciate your
point,
soapbox. I do.
absolutely. I've got plenty of soapboxes. I've got a whole building built of them in the backyard. So for frozen shoulder, there's not, to the best of my knowledge, there's not a lot of great consensus as to what sets it off. They
Oh,
actually call it idiopathic frozen shoulder. That doesn't mean you're an idiot for getting it. It means we're the idiots. We don't know what causes it. If you ever hear
oh,
the word idio means I don't know, pathic is the problem. That means literally we don't know what initially causes it.
okay.
I have a theory that I think works pretty well in that it starts as a as we call it an insult, but just a tweak in the shoulder. You pinch
Okay.
something. The most common cause of shoulder irritation by far is called impingement. Impingement means pinching. It means
Okay.
something in your shoulder has been pinched. The number one cause of this is poor body mechanics. And that, when I say poor body mechanics, think what you do when you get on your cell phone. Your chest hunches forward, your shoulders come up like this.
Mhm.
You fold in on yourself. And what happens is if that posture becomes habitual and you stay there, the next time you try to reach, you can't, and you're going to
Mhm.
force it, and that's going to pinch between your arm bone and your shoulder bone, the tendons in here. We call that the rotator cuff. I'm try not to throw too much medical stuff, but the idea is something get pinched. And you can
Okay.
test this on yourself. Stand up straight, chest out, reach up. You'll be able to reach real high, real easy. Flump down like this. Like, I have good
Right.
mobility. I'm a climber, but this is all I got when I'm like this. So
That
think
makes
about if you
sense.
live your life here, it's just a matter of time before you pinch.
Uh,
So, one of the big factors you can look for is, what does my comfortable resting posture look like? If your comfortable resting posture involves being hunched over like this, you are 100% at a higher risk for getting frozen shoulder, because it's just a
mm,
matter of time before you do something to tweak something. And if
mhm.
you already have an inflammatory disease, it's much easier to fall into that inflammation cycle. So that's one.
Okay.
Another thing to look for more immediate is when you do feel a pinch or a tweak. I'll just use my right shoulder as an example. Usually it's going to be here in the front or right here on the side. We call this the
Okay.
deltoid muscle.
Mhm.
These are the two main places you're going to feel those tweaks, because when you pinch stuff in here, here and here is where you perceive it. Sometimes here, that's super rare. But if you're doing something, you get a pinch right here and you get a pinch right here, and that pain sticks around for more than a few days, and you have type 1 DM or any other inflammatory diseases, I
Mhm.
would get that checked out sooner than later. Don't just be like,
Mm.
oh, it'll probably go away.
Mm.
You want to get on this sooner when you have these other predispositions to inflammation.
Okay. Okay.
Is
So
that a thorough enough
what's
answer? Because I
it
could
is
keep
it,
going.
yeah, yeah, it sure is. And I think it just and I appreciate you just kind of pointing to the shoulders so we, because we are on camera. So if you're watching us on YouTube, bonus. If you're not, hop over to YouTube and watch the video because you'll be able to get us interacting. And we're just starting here. So this is a great way to kind of really understand, all of what's going on with the shoulder. Mine, and I'm going to point because mine, this was my worst, which was my left. No, I'm sorry. What am I saying? No. It's funny because now that I am thawed, I forget which one was worse, which is a good thing, right?
That's good.
My worst shoulder was my right. So this is, obviously we're looking on the opposite side of the camera, but I could not, go all the way back was impossible. Just
Yeah.
like you say, the pain for me, it was just stuck right here.
Yeah.
And trying to sleep on it was nearly impossible.
Yep.
And then my left was not quite as bad. So I was just switching back and forth, trying to find out when I went to bed at night which one was going to give me a little bit more ease in order to sleep. And I did a lot of the things that I know you help people with. I did go through the physical therapy. I think the hardest part for me, because I've always been an active exerciser and lifter, is having to modify my workouts because I really needed to. And it doesn't mean stop by any means. And I think you could probably tap onto this is it's important, even with pain, to keep the blood flowing. Isn't that true?
So I always tell everybody when they have a condition that we would consider chronic, that means you didn't fall and break or tear something and you don't have this huge heinous injury. It's always better to keep moving.
Okay.
Absolutely. With
Okay. Yeah.
modifications.
Yeah. Yeah.
I want to be very clear on that. Resting almost never fixes anything. It
That's a powerful
just
statement. Yeah.
is true. Resting is just sweeping it under the rug. Because yeah,
Hmm.
if going to your workout class hurts and you stop doing it, the pain's gonna stop, but that didn't mean you got better. It just means that you're hiding from it.
Right. Yeah. Yeah. So yeah, obviously, yes, sooner than later. Yeah, we need to eventually address it and to
Yeah.
to seek treatment for it. So I'm going to switch over and ask because we're going to definitely dive more into the actual mechanics and the treatment and the steps that women can take that may be experiencing this as we're speaking today. Why is it more in middle-aged women? I kind of know the answer to this, but I really
Yeah.
want you to explain it.
Sure.
And estrogen is a powerful hormone. This is another reason that we need to be in tune with what our estrogen levels, especially as we're getting older, they're starting to drop, and how estrogen does help mitigate inflammation in the body. But if you have a clinical way of explaining that, we'd love to hear it.
So there's a couple different levels I want to talk about this on. One,
Mhm,
there's a very mechanical level, just how the body's built. I'm going to
mhm.
address that. Number two, you already alluded to the chemistry of the body. And then number three, I would kind of branching off the chemistry, the neurochemistry of the body. So
Okay.
and first of all, I want to say middle-aged women are the number one demographic for frozen shoulder. That's absolute fact. I don't have the stats, but I
Okay.
mean, even back when I was in PT school, we knew that. That was a little while ago. Mechanically, I already showed you the posture.
Mhm,
It's the forward rounded posture like this.
mhm,
You know, they call it dowager's hump. That's not a very generous term, but it's in the female because
mhm,
women are more prone to this posture.
mhm.
There's some reasons for that. Women are the only gender that can bear children.
Right.
And childbearing has a tendency to draw everything forward. And
Mm,
if that is never, I mean, you have pregnancy, which does this, then
mhm,
nursing, which lasts even longer.
mhm.
And you're always bending over taking care of the kids and things like that. And
Right.
if you never undergo a program to reintroduce, we call this extension, when you arch your back and open up your chest. If you never reintroduce that extension, this starts feeling normal to you and it's all
Yeah,
you.
that's so
So
true.
that's one, and that'll stay with you for the rest of your life. Number
Mhm,
1. Number 2, this is cultural. Culturally speaking, women tend to go to more, like, aerobic fitness classes, spin classes, yoga classes. Just culturally, women are not marketed to for actual strength training, and strength training is very good for teaching you to develop that extended open posture, because if you're trying to weight life like this,
that's so
it's
true.
not gonna last very long. And if you've ever received any good coaching, they will teach you to open up your chest, keep a good upright posture, and then you develop those muscles in your back doing things
Mhm,
like rows and
mhm.
deadlifts and flies and pull-ups and all of those fantastic exercises that will really help you balance out your posture again. And women just don't have this presented to them very much. And I think that's a cultural shortcoming we experience.
Yeah.
So those are 2 reasons, and then if we move over into the chemistry, when women hit middle age, their hormones start to shift, and their body is no longer able to maintain a healthy balance of inflammatory factors. So very
Mhm.
simply put, the chemicals in your body are more prone to inflammation once you hit middle age as a woman.
Yep.
And then throw type 1 diabetes on top of that, and it's a little bit of a perfect storm.
That's a perfect storm. Yeah.
And then let's talk about neurochemistry. Neurochemistry
Okay.
means how your brain works, how your emotions work, and how that affects your body. In our society, women have a lot of expectations because there's the traditional role of, mother, spouse, caregiver at home, nurturer, superimposed on this. Now there's the expectation that you're out with your career, and women are pulled in all sorts of different directions, and that causes a lot of stress. And when you are stressed, your sympathetic nervous system goes overdrive. That's the fight or flight. You know the
Mhm,
feeling. Palms get
mhm,
sweaty.
mhm.
You feel like you're pulled in every direction at once. And that will predispose you towards not handling inflammation as well. So there are, I think, a lot of biological, mechanical, and societal reasons that predispose women towards this. And the good thing about understanding this is if you know the cause of something, then you know how you fix it. So look, we have foreshadowing there.
Yes, yes, I love that, I love that. So how would we know if we have frozen shoulder as opposed to any other shoulder injury?
So this is where medicine gets weird because we name things,
Mhm.
but those are just names that we've made up.
That's so true. Yeah.
In my opinion, frozen shoulder isn't any different than any type of shoulder injury where you're just pinching stuff. It's
Okay.
not a different kind of injury, it's just a more intense version of the same thing, okay? So, I think that it's more important not to really understand what the doctor would call my shoulder injury, but to understand that, hey, something's going wrong. I know that I'm a middle aged woman. I know that I have type 1 DM. I should get this checked out sooner rather than later. So that's
Mhm,
the first thing. Shoulder, like a shoulder injury isn't mysterious. It's not like,
mhm.
we're not doing calculus here. Like it's gonna hurt in the front of the shoulder, the side
Yeah,
of the shoulder. You're gonna have pain. A certain movement will reliably and consistently reproduce pain in that region. Video viewers, you can see where I'm touching. If you're just on audio, it's your deltoid muscle. It's like where your shoulder slopes down into your arm. If that region is hurting consistently with certain movements, it's time to get help. Don't put it
okay.
away. That stuff usually doesn't just go away. You can wait maybe a day or two, but after that, I would seriously look at getting help. Now, if it's turned into frozen shoulder because it's awful, terrible pain. Like Melissa said, you can't sleep. You don't want to move it. It's distracting. It can be throbbing. It absolutely changes your mood. It makes you cranky. It makes you feel
Right.
exhausted and overwhelmed. That's what frozen shoulder feels like. You can't sleep on it, and you will notice increasing difficulty with being able to lift your arm overhead. Like it's really common, and you'll see this thing. People will start, instead of just
Mhm.
raising their arm nice and smooth like this, they'll raise their whole body.
Right, right. They
And
have to
so if you
compensate.
find yourself doing those things, then yes, definitely time to seek help because like 99% certain you have what we would call frozen shoulder. And I want to
Okay,
emphasize frozen shoulder have a lot of initial, like lots of different things could cause that first inflammation, like,
okay,
playing a sport or just reaching funny or falling or something like that. So frozen
okay,
shoulder kind of describes the reaction to it more so than the actual cause.
okay.
That makes
That's
sense. I hope
yeah,
that's
that absolutely. Yeah, yeah. I appreciate you just walking us through that. So, what is once, and I sure hope that the listeners are not experiencing this pain, but if they are, what's the first step? Obviously, they got to get with somebody that understands
right.
the mechanics, physical therapists like yourself that can assess and work with them. So, what do you typically walk through with a client as far as the assessment, the exercises? And you can share as much as you want. And if you happen to have an experience or a client
I've got a
testimony, we
lot of
would love to be
experiences,
hearing. Yeah.
some of which your clients wouldn't wanna hear. I'll give best and worst case scenarios, so we
Okay.
can do
Yeah.
that. That's fun. Maybe I won't give the worst case. I don't know. We'll see. So, if you suspect you have frozen shoulder or you've got this crazy shoulder pain that's driving you crazy, definitely go seek help. If you're in a place where you have direct access to physical therapists and you can just go to the physical therapist, do that. Because when you go to the doctor, spoiler alert, they're gonna charge you your copay. They're gonna look and be like, "Oh, you have shoulder pain. Go to PT." So you can save yourself some time and money by
Sure.
just going straight to physical therapy.
Hmm.
If you are somebody who's on a insurance plan who allows that, or if you're the type of person who prefers to pay cash for insurance because of the convenience that that brings,
Hmm. Hmm.
uh, skip. Any physical therapist is going to know frozen shoulder, and we are the ones who handle it, or chiropractors, or physiatrists, people who work with physical medicine. These
Okay.
days, chiros and PTs are getting very hard to tell apart. So either one of those
Okay.
is fine.
It's good to know.
So that's step one. And then what you should expect when you go in for your evaluation, they absolutely should be, of course, assessing your shoulder. They're going to move it to see what the rate, we call it range of motion. That's basically how far it moves.
Hmm.
Then the evaluation should not stop there. They should also be assessing your rib cage. They should be looking at your posture. How well does your rib cage move? People don't think about the rib cage moving very much, but
Hmm.
this is a part of our body that needs to move, but because of our modern society and culture doesn't move very much. That's why people do
Interesting.
get so many problems with their shoulders. That mobility, your ribs, how well does your spine here move? How well does the neck move? This is going to sound crazy, but you got to look at the hips. The hips are the foundation for the spine. So if your hips and your pelvis aren't moving right, then that can absolutely affect your shoulder. And it goes even deeper. Your feet affect your hips. So really, the best case scenario is a head to toe assessment. At a
Hmm.
bare minimum, to be the shoulder and rib cage. I say that because most clinics, you're probably just going to get chest and rib cage. If you can get more, that's better.
That's really good to know.
And
And
then
yeah, yeah, and we're all about going in with the little notepad because,
yeah,
you gotta advocate and, to know what to ask for and to what to insist on if it's not happening,
Yes.
or when to find another therapist if you're not getting what you really truly need. So yeah, we
Yeah.
appreciate you
So
sharing that.
this is great, Melissa. I'm glad you said that. When you go in for healthcare, you need to approach it the way you approach buying a new car. Like, I don't know about you, but like, regular people, they turn into sharks when they buy into, they become CEO expert negotiators. They're like, I'm going to get every last little bit out of this deal. But for some reason, when we go to get healthcare, arguably the most important commodity we purchase, we
Yeah,
turn our brains off and we're like, yes, doc, we'll do whatever you say
it's
without
true.
even thinking about it. And
Hmm.
too often I hear people talking about, oh, my physical therapist is so nice. They're so nice. They're so nice. This is what they're doing for me. And I'm like, that is just inadequate treatment. So I would like everybody to be a little bit more self-centered when you seek healthcare. It's not enough for your practitioner to be a nice person. That's a great bonus, and they should be a nice person. But you need to demand a certain level of care, or you absolutely should be taking your business elsewhere, because that's the
Yeah.
only way healthcare improves, just like everything else in our economy.
Hmm.
With that being said, so I already told you what to expect for your evaluation. Treatment should involve some sort of stretching exercises. Fun fact, when you stretch the shoulder, it shouldn't hurt. And this is very tricky. That's one of the hardest parts of physical therapy, getting a good stretch without pain. If you are stretching your shoulder and it is hurting, guess what? You're just causing more inflammation and you're feeding into that inflammatory cycle. And the problem with that becomes, instead of regaining true shoulder movement that looks like this, you get compensation movement, which looks like this. I
Right,
see a
right.
lot of people that are like, oh yeah, I had frozen shoulder, I had great physical therapy, and I've got all my range back, like
Yeah,
that. And I'm like, you don't say much because you don't want to rain on their parade, but it's like, no, you didn't get very much range back at all. You just
right.
learned how to do all these
Kind of
crazy
compensate.
compensations doing
Yeah,
these exercises that were
yeah,
not addressing the problem. So I would encourage all of your listeners, if they have frozen shoulder, to just do this in the mirror. How does it look? Does the shoulder stay down? Does it look nice and clean? Or are you leaning to the side? Does your neck tense up? Does your back do all this weird stuff? If it's the second one, you might consider going somewhere else where they're a little pickier about how you do your
yeah,
exercises.
absolutely.
You need a lot of personal attention with frozen shoulder. You
Yeah,
can't go to a clinic and the PT sees you for 5 minutes and then just sends you on your way to do your exercises.
guys is at home. Yeah,
You're not
yeah,
gonna get better,
yeah,
and that's
yeah,
that's when you need to choose a different clinic.
absolutely. So what is the typical, and I'll call it the thaw time? And I know
Right.
it's probably different for everybody,
Yeah,
but
it's
what's
wide range.
yeah, so for me, it probably took 4 or 5 years.
Oh, that's really okay.
Yeah,
That's
yeah,
long. That's long.
but it slowly got better. Yeah, again,
With
I still keep thinking of all the other things that were going on. I was not on hormone replacement when I got frozen shoulder. So
right.
again, the things that we weren't doing at the time, I wondered if it would have helped, or would have helped my healing, if would have helped the actual, start of the pain, when it started. So again, these are things I won't know because I can't go back and change that. But and then, what is the expectations? I know there are some people, there's women in my community, I hear from you, who have or either have gone through frozen shoulder or are still currently suffering with it. And I know this is really going to help serve them, because I think it's really number one is validating what they're going through, because it's very hard. It's very, if you don't have the support and, the experts helping and assisting you to heal, it can be life altering. So, what hope can you give those of us who have either gone through it or are currently going through it?
Depending on the severity of the case, it's possible to get it cleared up in a matter of months. I've worked with people with stiff shoulders that, they get better
Okay.
fairly quickly. If it's a more severe case, it's gonna take longer. I would say 4 to 5 years is really very, very on the
Very
long
long.
side of things. I would, usually the longest you're looking at it, would prefer to look at is like a year. If you're getting treatment, I would feel like 6 months is the longest I would wanna see it going on.
Okay.
I'm kind of a weird physical therapist. I think if you're not seeing really quick results, you're not doing the right thing. When I work with people, I prefer to see results that first day. It's not going to be 100% results, but I need to see significant improvement to know we're going down the right path. That's another thing. It's true that things take time to heal, But if you're receiving medical treatment and you're a couple months in and you're like, I'm not sure if this is better or not, you need to you need to have a
Yeah.
frank discussion with your
Yeah.
provider and say, hey,
Yeah.
do you think this is working? Because I can't tell the difference.
Yeah. Yeah.
You definitely should be seeing improvement within 1 to 2 months of treatment. And I
Okay.
want to be really clear. I want to say this again because so many people come out of physical therapy this way. This is what normal looks like. And to those of you who are just listening, my shoulder is nice and low. There's like a solid 6 inches between my shoulder and my ear. This is not. Your
Hmm.
shoulder is literally touching your ear and your arm's still not all the way overhead. This is not okay.
Mm.
This just means you learn how to compensate really well.
Yeah.
This means you actually got better.
Yeah.
So,
Right. Right. Understanding what your new normal is. So your new
right.
normal should still look well close to the original.
Yeah,
It
your new
should.
normal,
It should.
like
Yeah.
it's a very realistic expectation that you can go
Yeah.
back to completely normal after
That's
frozen shoulder.
awesome.
That's the
That's
point.
awesome.
Frozen shoulder
Yeah.
should not be like a life-changing event. It will change your life in the short term, just like a broken
Okay.
leg will,
Hmm.
but in vast majority of cases, you should get back to normal.
Yeah.
And
Um, and I'm going to interrupt you just for a second. What about surgery? Because I have heard of, I've
mm,
actually heard some
mm,
other,
yeah,
I
that's my horror
know,
story.
and I've
Yeah.
heard, okay, and I've heard of how, and if you want to describe what that surgery is, because I've heard what it is, and it sounds excruciating, but in
Well, you're
some
asleep, so you can't
cases,
feel it.
I know, but I mean, I actually was listening to it was another show, two doctors that live with type 1, and they were talking about frozen shoulders. This was about a year or so ago. And he went into a lot of detail because I guess he had to have the surgery.
Yeah.
And, just like you say, your point is, yeah, obviously you're not awake for it, but just hearing about it, and I don't want to scare anybody away from surgery if that has to be your next step. But how often is that really the last chance
That
to
absolutely should always be the
be the
last resort.
last? Yeah.
Absolutely. I would recommend going to, like, this might sound excessive, but at least 4 to 5 different physical therapists before you get that
Resort to
done.
that.
Yeah.
Okay. That's really
Um,
good to know. Yeah.
yeah, physical
Okay.
therapists are like cars. Just because one doesn't work for you doesn't mean you stop driving. You just find a better one
Okay.
or a different one that vibes with you, right?
Absolutely.
An important thing to understand about the medical system is all doctors and nurses and physical therapists, we're all people. We are all very different. Like, yeah, we went to the same school, but after that, our experiences diverged wildly. And
Mhm.
everybody has these little things they're good at and different things. So just because one or two or even three physical therapists can't get you where you want to go, I always recommend you really keep trying there.
Shop
So
around. Yeah. Yeah.
the name of the it's calling it a surgery isn't even like it's not even really a surgery. It's called manipulation under anesthesia.
Oh, okay.
That's a very fancy way of saying we're going to knock you out and force your arm up overhead. And
Mm.
that's what they do. They
Yeah.
knock you out, they grab that arm, and they you crank it overhead.
Mm.
And the
Yeah.
concept is they're going to break all of that scar
Scar
tissue off.
tissue. Yeah. That's what I've understood. It's
Yeah, I mean,
last ditch.
that's why this is a last ditch, and I
Okay.
guess sometimes it really is necessary. I
Okay.
will say I had one lady, and this was over a decade ago. We worked on her and worked on her, worked on her. We couldn't get anywhere, so they went ahead and did it.
Okay.
Instead of loosening up the shoulder, they broke her arm. Yeah,
Goodness.
and I wanna be very clear, the surgeon who did it is a fantastic surgeon. I
Mm.
have no doubt that he did everything right. It's just stuff happens when you do
Yeah.
that. So
Yeah.
that's why I'm so adamant about really seeking all options because,
Sure.
yeah, a lot of times surgery turns out okay, but there's no guarantees ever with surgery.
Mhm. Mhm.
And so
So
you said
true.
you didn't want to scare anybody away from surgery. I think we need to have a healthy, maybe not fear, but a respect for the fact that when we go in and start doing these big alterations to our body,
Yeah.
that they're very permanent and they are absolutely last ditch efforts.
Yeah. Yeah. I appreciate you clearing
Yeah.
that up or just confirming what I was thinking as well. Really good. Really good. So is there anything else that maybe we missed today? We talked about what it
Let's see.
is, what to expect, how to
Right.
identify it, the process it takes for healing as soon as we can. Again, we don't have any really good scope on how long that would take because it is very individual. But is there anything maybe that I left out?
So I want to talk about some of the parts of medicine that we don't talk about enough, and that's mindset, self-image, and beliefs. So often when people have these significant painful injuries or conditions that change what they're able to do, either the medical system blatantly tells them or they come to the conclusion on their own that I am broken and I'm always going to have to limit what I do. And I want to be very clear that our bodies are so much tougher than everybody always gives them credit for. Like, it was just a couple thousand years ago that we were all running through the woods killing animals with sticks, and
Mm-hmm.
that's how we got food.
Mm-hmm.
So, if you get frozen shoulder, you're not broken, you're not fragile, it can get better. Yes, you're gonna need good help, and you're gonna be exhausted. Some days you're gonna wanna feel like giving up, but very much, if you have frozen shoulder, it's a very hopeful situation.
I
You
like that.
just have to find the right person who has the right skills and the right personality to get you through it, and somebody who can instill the right mindset in you, the belief in yourself, and also the accountability to stick with the exercises that you need to do to get the results that you want.
Yeah. Yeah.
So
Yeah.
that's really important. The mindset piece is hands down the most important part of healing, and unfortunately, it's left out in almost every case.
Yeah. 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 You have to go in believing that this can be better, that you will feel good again. Yeah, absolutely. Because yeah, you
Absolutely.
can you can convince yourself that you'll always be in pain and that this is the last ditch. And we as we live with a disease that can be very compounded with all of these different things that come up with it and inflammation. And another thing I wanted to add to this, and I know you can agree with this, is once let's say we're diagnosed with something like frozen shoulder or really any sort of, I have a hard time with that word, musculoskeletal, what am I
You can
trying
just
to
say
say?
bone and joint.
Bone and joint, is that easier? Yeah. It doesn't roll off my tongue easily. And it's so tied to low estrogen. So this is just another reason for the women here to be aware of how important it is to be in tune with your hormones and to have practitioners that you can talk with about that, hormone specialists. And not to mention lifestyle. I know that something like this, when it's painful, is getting on you. Not only are you physically hurting, but it does affect us, our mindset. It affects us emotionally and just our get up and go with everything in life. And it's easy to let go of other practices that we know support blood sugar because we need to keep the inflammation down. We need to continue to try to keep our blood sugars in healthy ranges because that's going to support healing. We all know that. And, diet, sleep, having fun. I know it's hard to say when you are in pain, but trust me, we really do need to tap into these things because it's going to help the whole healing journey for sure. So just another reminder.
Absolutely. It's very
Yeah.
important.
Yeah, I appreciate it. Well, Matt, I appreciate you coming in and just giving us the frozen shoulder one-on-one topic
Absolutely.
today. It's
And
really important. Yeah.
yeah, and also, if there are any listeners out there that you don't have any healthcare practitioners that you can trust or you don't know what to do, at my company, Renew Strength and Wellness, we always start with a phone call, and that's always
Hmm.
free. And it's a chance for you to tell your story, to find out what your goals are, and then we talk to you, kind of guide you in the right path. And, even if that doesn't end up being working with us, we can send you in the right direction of, what's going on, what
Hmm.
do I do next? And just having those few simple answers can often make a huge difference in, your mindset.
Yeah, I appreciate that, Matt.
Yep,
Absolutely. And I'll be sure to link your website and we can find you on Instagram as well. I know that you're
absolutely.
active on there. So these are
Yep,
ways to reach out and get an idea of what both Matt and Sandy are doing in their practice here in Florida. And, again, thank you so much. This is a very important for those of us and it's becoming more aware, we're becoming more aware of how unfortunately it could be something that we experience, but I really think it's really important just to kind of load our guns and to be prepared, to know what to expect, what to expect and some ways to, try to help mitigate it. So that's our goal here. Again, thank you, Matt. I
absolutely.
appreciate you.
A lot of fun.
And yes, you all have an amazing day. We'll be back in here same time next week. Bye for now.